My name is Ryan Neuhofel. I'm a family physician in Lawrence, Kansas, and I have a direct primary care practice that I started in 2011. And one of the issues I'm most passionate about is physicians regaining autonomy. I think over the past few decades, although I've only been out of residency for about 6 years now, is a sense that physicians are losing control and that they're not able to accomplish what they set out to do when they decided to become a doctor. And so my path to doing that was starting my own practice in an independent direct primary care model. And as I went through training, I saw a lot of doctors very burnt out. And I think a big sense of that was that they felt powerless. I talked to physicians who had only been out of residency for a few years, and physicians who are nearing the end of retirement, and what I often heard from them is that they were working harder, they were more stressed, that they were frustrated, that they weren't able to provide patients the care that they deserved. And so I really kind of reached a crossroads, I guess, early on in my medical training, because I didn't see a path for myself. I knew I wanted to be a primary care doctor, and I still had that vision, probably an overly romantic vision of what being a family doctor would be, but I didn't see a path for me to accomplish that. So I kind of reached the conclusion that I would have to start with a clean slate. And at the time, there wasn't a lot of examples of what I was doing. So that was kind of my way to fulfill my vision. And to do that, I really had to kind of really think outside the box and kind of maybe ruffle a few feathers. But in order to regain that independence and that the freedom to fulfill my vision of being a doctor, I took on a direct primary care model. And it's been wonderful. It's not without challenges. Being a business owner itself is very, very stressful and comes at huge sacrifices and risks. But I think the sense of independence that I have and the hard work that I put in, the sacrifices that I make, I think that at the end of the day, I think they're for good. And I think that's where a lot of physician burnout comes from, is they feel like they're working their butts off and it's not for any discernible benefit, either to themselves or to their patients. So, we just went through a whole other, political debate about healthcare reform, and it sounds like it's kind of going nowhere. And although I've only been out of residency for 6 years, it seems like a persistent deja vu, that we end back up in the same place over and over, and physicians are all watching this and I guess waiting for things to get better. And I've reached a conclusion that things are not going to get better unless physicians grab the rein and do it themselves. And I think part of that is being independent from the system.